What if a simple blanket could ease anxiety and improve sleep for someone with dementia? Stick around because I'm about to show you how. Now you might be thinking, a blanket? What's the big deal? But for someone experiencing the challenges of dementia, a weighted blanket can be a source of comfort, security, and even help with some of those tricky symptoms. First off, let's remember what we're dealing with. Dementia and Alzheimer's can bring on a whole host of issues, like anxiety, restlessness, and sleep problems. These conditions can disrupt the nervous system, making it hard for someone to feel calm and settled. That's where weighted blankets come in. They work on the principle of deep pressure stimulation, which is basically like a firm, gentle hug. This pressure can trigger the release of serotonin, a neurotransmitter that helps regulate mood and sleep, and melatonin, a hormone that promotes sleep. It also helps lower cortisol, the stress hormone. So how does this translate to someone with dementia? Well, imagine they're feeling anxious or agitated. The gentle pressure of a weighted blanket can help them feel grounded and secure, like they're being held. It can reduce restlessness and promote a sense of calm. And let's not forget about sleep. Sleep disturbances are super common in dementia, and they can make everything else worse. The deep pressure from a weighted blanket can help them fall asleep faster, stay asleep longer, and wake up feeling more rested. Now, you might be wondering, how do I choose the right weighted blanket? Good question. The general rule of thumb is to choose a blanket that's about 10% of the person's body weight. But it's always wise to consult a doctor or occupational therapist, because individual needs can vary. You also want to consider the fabric. Go for something soft and breathable, like cotton or bamboo. You don't want them overheating. And think about the size. A smaller blanket might be easier to manage, especially if they're using it in a chair or wheelchair. It's important to introduce the blanket gradually. Let them get used to the feel of it. Start with short periods of use, like 15 to 20 minutes at a time, and gradually increase the duration as they become more comfortable. Keep in mind that weighted blankets aren't for everyone. Some people might find them too heavy or restrictive. And if they have certain medical conditions, like respiratory problems, you should definitely talk to their doctor before using one. But for many people with dementia, a weighted blanket can be a real source of comfort and relief. It's a simple, non-pharmacological way to help them feel calmer, more secure, and get better sleep. And honestly, sometimes that's exactly what they need. It's about finding those little things that can make a big difference in their quality of life.